It's uncomfortable, makes you feel self-conscious, and when it's severe, it can really affect your mental health. Acne. Most of us think we know what it is, but how much has our understanding of it evolved, even in the past few decades? Dr. Joanne C. is a dermatologist and co-chair of All About Acne, which is a group of independent skin experts who work towards better education about acne. Joanne's also on the International Global Alliance to improve outcomes in acne. Joanne, welcome.
Good morning, Hilary. Thanks for asking me to speak to you about this very difficult topic.
And it's one I think that we all think we know about, but perhaps don't know as much as we do think we know. Tell us, what's acne as distinct from just pimples?
Okay, well, acne is the medical condition, and we've got to remember that that's what we're talking about, whereas pimples are what we see, whether they're superficial or deep. And the reason why we're all experts is because most of us have had an episode of acne in our lives, I think.
Yes, indeed. And we think, oh, well, it'll pass, or we can fix it with diet or cleaning or something. But tell us a little bit more about the physiological process that happens when a bad case of acne develops. It's not just a little passing infection, is it?
Well, the same thing, the same causes happen, the little pimple and the big pimple. And what you're looking at is a hormonal stimulation of our oil glands producing more oil or sebum. Then we get a blockage of the pilosebaceous duct, or what we know of as our pore. We get inflammation, and we all have good and bad bacteria on our skin. And there's this interplay between these four things. And so it occurs typically in the teenage years when our hormones are making us stronger, giving us our sexual characteristics, but it can continue on.
And is there an immune system interplay as well, Joanne?
Absolutely. So we used to just think of it as just a skin disease, but what we're looking at now is an interplay with our own immune system. And so the factors that cause acne maybe are worse in some people because genetically their immune system might be turned on even greater, so they'll get more severe acne, deeper lesions, red, angry ones, or their acne might lead to scarring.
It's really interesting to see our Facebook page has lots and lots of stories of the terrible impact that acne can have on people's lives, and that it can come at different stages of life too. Is there a hormonal factor at play there?
Yes, there is. So most of the acne that we all experience is between the ages of just, say, our teenage years up to the age of our early 20s. And that's thought to be 85% of the Australian population. And that's a time when our hormones are increasing. But it can continue on. And what some people say is that 50% of people can have acne from 25 onwards.
That must be a pretty depressing thing if you continue to have acne beyond the time when people socially expect you to have it.
Well, I guess the thing is that's one of the myths, and it saddens me when someone comes in and said, you know, my parents told me to get over it. It should be over by now. So they feel really cheated because in their 20s and 30s, that's a time when they're socially engaged, they're finished school, they're meeting new people, they're in jobs, they're giving presentations. That's the time when it can really affect somebody's self-esteem, their self-confidence.
Indeed. And what kind of long-term impacts can that have, Joanne C?
Well, I think one of the things is when you treat acne effectively, you give people back their confidence. And a lot of people, for instance, are socially phobic. You know, they might think, I'm not going to the beach. You know, they've invited me out to a party. I can't wear that dress, or I don't want to take my top off in the gym, that sort of thing. So it can affect how long somebody takes to go out. You know, they might spend ages putting their makeup on. They might not feel confident to speak at a meeting. So it does affect people day to day.
And as you say, you know, it's not just the face, is it? If you take your top off, it could be on your chest or your back. That might be something some people don't really understand either.
Well, there was a recent journal article and it said truncal acne, a neglected entity. And I think that reflects the fact that we go to the doctor, they see our face, it takes a little bit of delving into, do you have it on your chest, do you have it on your back, which is very, very common because that's where oil glands are too. So naturally that's where we get acne as well.
Just touching back on the hormonal issue, Joanne C., I saw a couple of comments on our Facebook page saying that they'd had really bad outbreaks when they got a contraceptive implant. Is there a link there?
Yes, there is. And so what actually happens, usually when people are on the combined oral contraceptive, so the pill, a tablet, that can often improve their acne. But if they have a progesterone-only implant, that hormonal trigger, that androgen stimulates their oil glands. So sometimes we actually do ask patients to remove the hormonal implant.
Yep, we've had people talking on the Facebook page about how vast improvements have happened, and I think that's what we're all hoping to hear from you today, Dr. Joanne C. How do you fix acne? Joanne's a dermatologist and co-chair of All About Acne, and she's on the International Global Alliance to improve outcomes in acne. Let's look at some of the things that people claim can fix it. What about things like cleaning your skin very well or having a good diet?
Okay, well, let's start with washing your face. I think washing your face is really important. You don't have to do it with anything really, really expensive. But the aim of washing your face is it actually cleans off old dead skin cells, sebum, pollution. It unclogs the pore, so to speak. So washing your face twice a day is reasonable, especially if you live in a polluted city or you're wearing makeup. Diet is really controversial. And I guess I'd like to bust that myth of chocolate. So I think everybody thinks about chocolate, eating that is a problem. Studies have shown that that's not true. I probably would say that some people are affected by their diet, but not everybody. And what we know is if you have a normal, healthy Western diet with a lot of unprocessed, so fruit and veggies, that's a good thing. Excess weight can be a problem. And the other thing is dairy. Patients often say, I think dairy is a problem. It probably is true in some people. And what we think is milk could be a problem. Certainly whey, which is a milk protein often found in athlete powders, can cause acne. But people now think that cheese and yogurt are okay.
Wow, it must be quite confusing for someone with acne trying to work out a diet that's going to help them. Is it easy to get good information from your GP, or do you need to tend to go to a specialist dermatologist for that kind of information?
I think there's great information everywhere, and your GP is the perfect place to start. And if things don't go well, if you're not getting an improvement, then maybe seek the help of a dermatologist. But I think that one of the big problems out there is so many people are going on to social media, and recent studies have shown that some of the information is not that great, and it has a very, very poor correlation with objective scientific information.
And when you were talking before, Dr. C, about washing your face, were you talking about just soap and water, or were you talking about some of the topical washes that are sold for acne in particular?
Look, we tend to, in many ways, stay away from a true soap. There are a lot of soap substitutes that look like soap but don't strip the skin of its natural barrier. I think that there are a lot of great, inexpensive acne washes out there, and you can get them from the supermarket as well.
And Joanne, All About Acne, your organisation does get some support from drug companies and skincare brands. We'll talk about drugs in a moment, but there are lots of different treatments on the market. How useful or recommended are things like facial peels? Does the research say they're effective?
They are effective, and facial peels can be very helpful because they unclog the pore. They can be really good in people, for instance, who are pregnant, who can't take oral medication. The only thing is they're often helpful in conjunction with other medical treatments.
Such as?
Well, such as, you can go to the chemist, you can get benzoyl peroxide. It's been around forever, highly, highly effective, as are other washes and leave-on products which contain what we call active ingredients like salicylic acid. So they're well proven topical creams, lotions and washes. I think after you've used those, if you're not getting better, you might want to go to your GP because you may need a prescription product. Antibiotics have been used for decades safely and effectively, but we've also got to make sure that we don't use them for too long.
And is that about their effectiveness in particular individuals, or is that more a general antibiotic resistance issue?
That's the worldwide issue of antimicrobial resistance worldwide, and good antimicrobial stewardship is to use oral or topical antibiotics in conjunction, say, with benzoyl peroxide, or for a limited period, maybe a trial period of 6 to 12 weeks.
And a lot of people who are on antibiotics regularly know that they can mess with your gut health. And Joanne C., we've had a question via text message, 0418 226 576, asking if there's a link to gut health with acne, if it's immune related. Is there research on that?
Absolutely, and that's what makes medicine so exciting, because there's so much research, and the skin microbiome and the gut microbiome have been looked at and are continuing to be looked at. So what we think is, yes, if you're taking antibiotics, consider a probiotic, and more research is actually being done into skin probiotics.
That's fascinating, isn't it? The number of bacteria living on our skin, and it tends to freak us out, but obviously some of them can be very useful to us.
Well, that's, again, new research, because what we used to think, it was always the acne bacteria and that we had loads of it. But now what we're thinking, and we're rethinking, is that maybe we all do have acne bacteria, but it's the strain. It's certain acne bacteria are the ones that are causing the problem. So as medicine becomes more targeted, we may target treatment into those people carrying particular strains.
Dr. C, before we go, we do need to talk about a particular drug that people might have heard about in relation to acne, isotretinoin, and people might have heard of one of the brands of this drug, Roaccutane. Tell us a bit about what this drug does.
Well, it's a synthetic vitamin A. It has been available for decades now, and there is a lot of controversy. It's dermatologist prescribed, but it's only for a certain group of patients, and those are the patients who have severe acne. It's often nodular or cystic, and they've often been on treatment and failed treatment. The other group of patients can have scarring, and as we know, scarring is permanent. So if there is a high risk of scarring or scarring's already occurred, you may want to think about referral for isotretinoin. And yet again, another group are those patients who are really psychologically affected by their skin, because we know that a course of oral isotretinoin can help acne effectively and more quickly and more certain than a lot of other treatments.
It has had a shadow over it, hasn't it? Because there have been reports of associations with an increase in mood disorders or even suicidal ideation. Where does the science sit on that now?
It's actually very interesting, because I think that in the scientific literature, more and more, the majority of articles coming out recently have shown that the risk is very, very low. In fact, when you look at the risk of depression and suicide in acne patients who are not on oral isotretinoin, their risk is higher. So it's thought that with safe, effective treatment, a patient's quality of life significantly improves, and that can certainly happen with a course of oral isotretinoin. But as a practicing dermatologist, these patients are screened, and we always say to our patients that we want them there's an open door. If you have a problem, if you have an issue, we want you to contact us. And most certainly it's a three-way play with contact to your GP as well, who we work closely with.
Indeed. And it is, it's quite startling to see the prevalence of depression and other mood disorders in people with severe acne. It certainly warrants further investigation, and you hope that people can get the treatment that they need. Dr. Joanne C., thank you so much for sharing your passion and excitement about science with us today, in particular around acne.
My pleasure. Thank you very much for asking me.
It's my pleasure. Dr. Joanne C. is a dermatologist and co-chair of All About Acne, and we'll put a link up to their site on the Life Matters homepage.